347 confirmed positive COVID-19 cases. There are 18,684 recovered cases and tragically 220 deaths. Nous continuons de travailler.
We continue to work with First Nations and our partners to follow the situation closely. We must remain vigilant. New variants of COVID-19 continue to be a threat for First Nations, Inuit, and Métis communities. In order to maintain a low number of cases and vaccinate the largest number of people possible, we continue to work tirelessly with organizations and Indigenous communities. As of 23 February, 440 Indigenous communities had begun vaccinations. Over 103,000 doses have been administered, with BC and Quebec leading all other provinces when it comes to the number of Indigenous people vaccinated.
Communities, we're also supporting vaccine rollout in cities and towns across Canada. Urban Indigenous populations face many, if not the same, systemic barriers to accessing services of those living in isolated or remote communities or on reserve. The National Advisory Committee on Immunization has recommended that all Indigenous adults be a top priority group for vaccination in the second phase of vaccination. This is because Indigenous populations are more vulnerable to the effects of the virus due to unequal access to healthcare and socioeconomic factors. Provinces and territories must continue to engage with Indigenous partners and leadership while we continue the vaccination campaign. Yesterday, I spoke to Chiefs Fox, Greer, and Crowfoot of the Blackfoot Confederacy in Alberta. They have ultra-low temperature freezers ready in place for the Pfizer vaccine and are eagerly awaiting for the allocation of the vaccine from the province. As well, I encourage everyone to read Dr. Theresa Tam's weekly statement, particularly this week's statement on the importance of prioritizing racialized populations, including Indigenous peoples.
My department is working in close cooperation with the provinces and territories, First Nations partners, Inuit and Métis organizations, friendship centers, and other community groups to support distribution of vaccines in urban zones. Our objective is to increase use of the vaccine and make sure it's available in safe and accessible places. Up until now, Toronto, Montreal, Winnipeg, and Ottawa have mobilized urban vaccination centers. The addition of clinics is also anticipated in other cities, notably Saskatoon and Regina. I'd like to share a few examples of the vaccination campaign.
In Ottawa got their first shots of the vaccine through the Wabano Centre and the Akausavik Inuit Family Health Team. It's part of a local effort to protect knowledge keepers and holders of tradition and culture. In northwestern Quebec, Cree communities are pairing their vaccination programs with traditional ceremonies and prayers. Incorporating traditional cultural elements in the process has helped reduce any hesitancy and fears of taking the vaccine. In British Columbia, on Vancouver Island, many First Nations have successfully administered second doses of the vaccine 6 weeks after they received the first. Looking north, approximately 95% of eligible residents have at least had one dose in the vaccine in Uluhuktu, Northwest Territories. The second dose arrived last week, and many residents will be completely vaccinated in the coming days. Across the country, we're making progress and slowly flattening the curve.
Once again, I want to salute the remarkable leadership of Indigenous communities for having coordinated and facilitated the distribution of vaccines. Your leadership has made a tremendous difference in the last few months and has doubtlessly saved lives. We continue to count on you to continue this vaccination campaign and respond to the propagation of COVID-19. We must continue to do our share to ensure the safety of everyone and follow the advice of our public health experts.
Take a brief moment to reflect on the progress we've made with First Nations across the country when it comes to access to clean water on reserve. In 2015, we made a commitment to First Nations. It was one to have access to clean and safe drinking water, and we remain committed. We will not stop until all long-term advisories are lifted, regardless of the challenges faced in getting there. That same year, when we came into power, there were 105 long-term drinking water advisories on public systems in First Nations on reserve. Once we began the work, it became clear that transforming water infrastructure on reserves also meant confronting a large system of patchwork policies and historic underfunding. For example, in the case of Shoal Lake 40 First Nation, there wasn't an all-season road to transport construction supplies. Building the road was an immediate priority for the community prior to starting the work on their water infrastructure. Each community has its own set of challenges. And from the beginning, we've worked directly with community leaders to identify and formulate the best path forward in each case. During Budget 2016, we allocated $1.8 billion to improve First Nations access to clean water. On October 2016, 15 long-term water advisories had been lifted. It was a small but important victory. Between November of 2015 and November 2017, 30 long-term water advisories were lifted on public water systems. And on February 2018, the community of Slate Falls Nation marked the 50th lift. Budget 2018 moved to provide an additional $173 million over 3 years to help accelerate progress on lifting drinking water advisories. And during the fall economic statement last fall, we announced an additional $1.5 billion to accelerate the work to lift all long-term drinking water advisories on reserve, bringing the total investments to over $3.5 billion since 2016. Part of this money will also provide reliable and lasting funding to ensure water infrastructure can be maintained in good condition and thus ensuring longer life cycles and more durable systems. This marks an important shift in how we approach water safety as a government. It will also mean problems with the water systems can be caught earlier and will prevent future long-term drinking water advisories. This funding will also support training for water operators and help communities to better retain qualified operators, local operators, for years to come. Brings us to today. We're shy of celebrating the 100th long-term drinking water advisory lift. Additionally, together we've been able to prevent over 175 short-term water advisories from becoming long-term issues. And we can be proud of the work done by First Nations communities, and we are all steadfast in our commitment to continue to increase access to clean water in the long term. While there can be a lot of uncertainty in construction and infrastructure, especially during COVID-19, as we're dealing effectively with the loss of a construction season, our government will always be there. Miigwech, nakumik, marcy cho, thank you and merci. I forgot to introduce, as usual, Dr. Tom Wong, the Chief Medical Officer of Indigenous Services Canada, who will offer some words, as well as Valerie Gideon, Assistant Deputy Minister.
Okay, merci beaucoup. Je tiens.
Thank you very much. First, I wish to recognize that I am on the unceded territory of the Algonquin people. I want to echo the views expressed by Dr. Teresa Tam and what Indigenous peoples can continue to face existing inequalities, colonization, the development of residential schools, racism, and social deprivation are part of the many factors contributing to existing inequalities when it comes to health. The marginalization of Indigenous peoples and the disproportionate repercussions among their communities have left them in a higher risk position, which is disproportionate and makes them more vulnerable to COVID-19.
Currently, no confirmed cases of the COVID-19 variants of concern have been detected within First Nations communities on reserve. But it is just a matter of time. It's not if, but it's when. In order to continue to stop the spread of COVID-19 variants and to prevent outbreaks, it is essential to redouble our efforts and to follow public health measures. As of February the 23rd, a total of 103,771 vaccine doses were administered, reaching 34 doses per 100 adults in First Nations on reserve, Inuit Nunangat, and territories, a rate that's 6 times that of Canada's. I'm glad to see that various provinces and territories have prioritized seniors, healthcare workers, and Indigenous peoples, in some cases, those living in remote and isolated communities, to receive the vaccines in Q1 of the vaccine rollout. Last week, we have seen the National Advisory Committee on Immunization further recommending that all Indigenous adults be vaccinated in Q2. Residents and community members of Wigwaman Terrace, an Indigenous retirement home in Toronto, received COVID vaccinations. The Anishinaabe Health Mobile Unit delivered the Moderna vaccines with the support of the Women's College Hospital. The Ahousaht First Nations in BC vaccinated 92%, and it's over 90% of the eligible population. And cultural leaders worked alongside community members and nurses and health professionals to ensure vaccinations were administered the Ahousaht way. And to Dr. Horan, a Mohawk physician, she has teamed up with elders and a number of healthcare professionals working to connect First Nations, Métis, and Inuit with information and Indigenous-led discussions about the COVID vaccines. The initiative provides information and resources grounded in traditional knowledge and worldviews. With that, I want to thank you all. Miigwech, Nakumik, merci, and marci.
Thank you. We'll now take questions from journalists. One question, one follow-up, and we'll start with questions from the room today. Nous allons maintenant prendre les questions des
We'll now take questions from journalists. One question, one follow-up, and we'll begin with questions from the room. Thank you.
Hi, Olivia Stepanovich, CBC News. Minister Miller, I'd like to get your response to the fact that people in Yamatang First Nation, they set up isolation tents in the summertime just to help with overcrowding, but now people are permanently living there, and these tents are canvas tents. They don't have running water, washrooms, and it's getting down to as low as -48 in this community, and people are living there. How is that acceptable, and what is your government planning to do about this?
Well, it isn't acceptable. I think one thing that we've seen through COVID is that the housing shortage, the structural underfunding, undercapitalization of communities is a real medical and health issue. I think we've had, difficulty as a matter of policy in the past thinking of it in those terms, but clearly it isn't new to Canada. This is the reality of many Inuit communities where crowding conditions creates a vector of spread for tuberculosis. So too with COVID, which is a pulmonary disease. And it's clear that we need to act more swiftly, specifically on housing as a government. And that's something that I take to the cabinet table, and many other ministers do as well. That's the medium term. In the short term, you can imagine how we have to be exceedingly careful as to how we support housing in communities that have effectively shut down or closed their borders and are focused on the health and safety of their own people. So where we have had outbreaks, we have moved swiftly to repurpose isolation areas in gyms, community center for people to isolate so that they don't spread COVID. And where we can, where it is possible, to make sure that we have units available. These were discussions that I had with many leaders over Christmas, as there was a huge spike in cases, particularly in Manitoba. So there is a capacity to move swiftly. These, as you highlighted and alluded to, are temporary measures, and they are unacceptable as a permanent solution. I don't think, Val, if you want to talk about Imatang a little more.
They've been very effective at controlling the spread of COVID-19 in the community. Absolutely. They have very few active cases, less than 5. But, the issue that you're raising is a much more sort of systemic one. I mean, we have invested in over 1,000 health infrastructure options and solutions specifically to respond to isolation, testing, screening purposes, as the minister has indicated, and over 70 million has been invested towards that. But these solutions were not meant to address sort of permanent housing needs in communities, and those remain quite significant.
For tomorrow on your department's response to drinking water, ensuring there's clean drinking water in First Nations. I would like to hear from you, Minister Miller. How would you characterize how your department has responded to this? And what, if anything, are you going to be doing differently to make sure there's clean drinking water on reserves going forward?
Yeah, I think this is a question that I will be more than glad to elaborate at some length once I've had a chance to fully review the report. I suspect it will confirm what my team and I have seen when we were asked when I was asked to take on this role. It's been 15 months. Looking at how we deal with water, we made a very important commitment to lift long-term drinking water advisories, and it is a very important one. I think it's an important one for all Canadians, in particular Indigenous peoples that have lived in these unacceptable conditions in many communities. And it is a goal we are focused on. This comes with a lot of issues that are deeply connected to it. One thing I know that is difficult to measure, and I have difficulty measuring, the Auditor General can't measure, is trust. And that is one, it is a persistent challenge that we face. You and I have talked about it in other contexts. And this is something that we have to keep building. I hope that we can learn something through COVID in terms of trust and how we deal with each other and how we deal with our relationships. But it will be an ongoing problem. I do want to speak to it at length, perhaps when I've had more chance to review it and discuss it with my team. I do think that said, we can't shy away from what COVID has done to slowing things down. We can't shy away from the fact that we moved quickly and invested $1.5 billion in the fall economic statement to address and take a more comprehensive view as to how we approach the removal of long-term water advisories.
Morning, team. Chris Najikoti, CTV National News. There has been issues with getting the proper water treatment plant operators training and hiring, of course. But the other main issue here is providing these operators with the right wage or salary so they will stay in these jobs. They are on call 365 days a year, 24/7. Has the federal government considered in securing proper pay and wages for these water treatment plant operators so they will stay in these jobs? And this is regarding on reserve.
And thanks for the question, Chris. And I've read it in the good work that's been done by the schools of investigative journalism that have come out with a series of articles over the last little while. And I think with a consortium of global and a number of journalists, it represents excellent work. I think that this is something that I've heard from leadership, and it reflects the conversations that the journalists themselves, and in some cases students, have heard and put together and put a lot of work into it over some time. This is something our team has as well been working on. I mean, it's the inevitable conclusion to the comment that someone is paid less on reserve as they are off reserve is it isn't fair. And that compromises this. You can have the state-of-the-art plant, but if the person isn't getting equal pay for equal work, maybe they should get paid more. I don't know. That isn't fair. And who's going to blame that person for wanting to go to a community that may, more often than not, be non-Indigenous and make more money? So the fall economic statement did a number of things. It acknowledged the fact that we need to do more in how we approach the removal of long-term water advisories. That includes comprehensive O&M funding, telling communities, in effect, that we'll be there for the long term and not just until March 2021, when we have achieved a very important goal for the country, very important political goal for this government, but one that reflects the needs of the community. So the recurring theme has been around operations and maintenance. It's sort of I guess, an accounting word for people behind the scenes that should be getting paid well and paid properly for the work that they do. And often they are the pride of the community because it does take some advanced chemistry and advanced math to operate these facilities. So I totally agree with it. It's work that's ongoing. I will not pretend to you here that it is work that is complete, but we are absolutely working on it in representing the policy shift that we announced in the fall economic statement.
When can changes, so these water operators are paid right? Is there a timeline as to when things can change down the road?
I don't have that for you yet. I'd like to see it as soon as possible. but it represents some policy shifts within the department that I, in fairness, have to go back and work on with the team. So we've acknowledged it. We know it exists. We know it's unfair. We're going to change it.
Thanks, Creason. Next question, please.
Chris Reynolds, Canadian Press. Today, the National Association of Friendship Centers is calling on Ottawa to allocate vaccines directly to clinics that serve urban Indigenous communities rather than waiting for provinces to do so. I'm wondering why the federal government is opting not to take this approach and distribute vaccines directly to these clinics that serve Indigenous people in urban communities.
Thanks for the question, Chris. There's a number of reasons, frankly. The first question we pose ourselves as a government is, what's the most effective way to get those vaccines into arms? We know, as the government, what is my effective capacity as a cabinet minister in the federal government to deliver vaccines is first and foremost on reserve and working with the 700 or so Indigenous Services Canada nurses that are working around the clock to make sure that the most vulnerable are getting vaccinated. Now, we know from the ANAICI rules, we know from the statistics coming out of the US, we know out of the statistics that are coming out primarily out of Manitoba that Indigenous peoples in urban settings are just as vulnerable as those that are on reserve. So the work then, the question that I then have to ask myself is, who do we work with to ensure that those people get vaccinated? And clearly the friendship centers are part and parcel of the deployment, particularly the larger lifts in and around the mass vaccination effort, because they know their people. They are culturally sensitive to the realities of urban Indigenous peoples. They may not have the effective resources. And then the question we have to ask ourselves is, who provides them and how quickly can we get them to them? So you can take the approach that the federal government is just going to hold something back and distribute it. But my question then is that the fastest way to get needles into arms? So what we've done, what we know through our works at trilateral tables and with the provinces is if we work with the provinces, those things can get done faster. And there is proof to show that, and we will continue that. Is it perfect? No, but we will absolutely continue to work with those friendship centers and others, because not every the friendship center network is great, but it doesn't have full penetration in all urban centers, and there are optimal institutions that can do that better. But we can't exclude the provinces from that relationship, because you're essentially putting yourself at odds with the people who have the primary responsibility over the medical system in that jurisdiction of choice. So it's a little more complex than saying we're just going to hold your vaccines back and distribute them because we're being asked to do so. It's a little more of a complex relationship that we need to reflect, and that includes the provinces and it includes them being at the table. And it's what we keep working on, mostly out of the public eye, but we're willing to speak about it publicly as well.
Would this approach that you outlined amount to an effective guarantee or to ensure that Indigenous people in urban areas do have access to vaccines across the country?
Yeah, I mean, the guarantee is to ensure that Indigenous peoples are being prioritized. And so I guarantee to those people that we will be working with the authorities in place to ensure that what the science is telling us is being implemented on the ground. There are logistical challenges highlighted, but it is one that is ever present. I would point you as well to Dr. Tam's weekly report that I mentioned to in my speech that is pushing very hard on ensuring racialized communities are properly vaccinated, because this isn't a matter of policy, it's a matter of science. If you get the people that are most vulnerable and that for various reasons have they themselves become vectors of spread, you're actually preventing the vaccine from propagating. But you can't exclude from that equation the participation of the provincial health systems.
Thanks, Chris. We'll now take questions from the phone. Operator, next question, please.
The prochaine question.
The next question is from Philippe Foisy from Radio Canada. You have the floor. Minister Miller, I'd like to discuss the Auditor General's report on drinking water that be issued tomorrow. When do you expect this to be critical? Do you think this will be a portrait of what happened before you came into the position, or is it what's going on now? Is it still legitimate now to lift these boil water advisories? We feel that there's a lot of spokes in the wheels even today, and it's quite complex to change things on the ground. Well, thank you, Philippe Vincent. As I said in English, I will wait to have read the entire report. I expect that it'll reflect what I've noted in my own department since I came into this position 15 months ago. That is that, yes, we are completely focused on lifting these boil water advisories in the long term. But there are a lot of issues surrounding this discussion, and I remind my audience of this every time I bring it up. It is not the federal government that imposes the lifting of these water advisories, it's the community itself. And what the Auditor General can't measure is trust. I have trouble discerning it when it comes to the federal government. And the approach we have, community by community, is to have this dialogue and find out what the community's priorities are. Of course, critical infrastructure, such as a water treatment plant, is clearly a priority, but it comes along with a lot of other issues, and these are issues we cannot neglect. If we take an approach that focuses exclusively on lifting boil water advisories, we will miss the opportunity to improve the relationship and leave many issues aside, which are very important for our relationship. Things that are not necessarily linked to the lifting of these advisories. I'm thinking of priorities that communities communicate to me, be it critical infrastructure that is undercapitalized and has been sometimes for decades. So I'm expecting that the Auditor General's report will reflect that reality and reflect the fact that a great deal of work remains to be done. There's work to be done on this approach. One of the things I've heard many, many times in the past 15 months is that the approach is not a combined one from the federal government. We know that in Quebec, there's a program that is fantastic, that works well, and means there are no long-term boil water advisories. That's not the case across the country. We know that the plant operators are highly qualified people, and the federal government funding formula leaves much to be desired. It's an 80-20 formula that asks the community to provide 20% of the funds. That's something we settled during the autumn economic statement when we announced an additional investment of $1.5 billion. But clearly, I expect the Auditor General's report to reflect that fact. Go ahead. I have a follow-up, don't worry. The question everyone's asking is, how come it's so difficult to solve this? You did mention a few things, but 15 months after you've arrived, I'd like us to sit down and look at the coming months and years. When you look at the situation, what are the difficulties, the obstacles that you see for the coming years? If you were to say, okay, we want to succeed, we'll certainly succeed, but until then, here are the 3 or 4 main obstacles that we have to surmount. What would those obstacles be in the short, medium, and long term? Well, above all, Philippe Vincent, there's a lack of trust in the federal government that persists at all levels between Indigenous communities and the government, with good reason. We know that underfunding of critical water infrastructure has been going on for decades. In the case of Naskana, which was highly media exposed, this it's a quarter century. We've made the necessary investments, but there's work to be done. We have to support that community. Somebody who's been under boil water advisory means that all children of 25 years or less have never had safe water. So clearly there's distrust. We have to have this communication with the community to give them the trust they're entitled to. It's very difficult for someone like me, who's non-Indigenous, who's never experienced this reality, to try to offer apologies and explanations for a quarter century of underfunding. It's unacceptable. Any apology I could present, any excuse I could give would not be credible. The challenge I face is to assume this responsibility and make sure with my team that we have the investments in place and that we have solutions for each community. That's what I want to do. I think that there are fewer than 40 communities under boil water advisory. And within that, there are 12 that are prepared to lift their water advisory. I want to be in a position so Canadians can look at our website and look at the state of things in each community and know that there are solutions out there, that there's a plan for each community. And this hasn't been reported much. In each community, there's a game plan, and there are people who work extremely hard to lift this advisory, to work with the community, make sure they have safe drinking water. And that's the position I want to be in late March, so that if anybody has questions about a community, they can find out what's going on and what the game plan is. There's Show Late 40 that I mentioned in my introduction, in Bay of Quinte, Mohawks, who have 13 boil water advisories, but they have all the investments necessary. Last time I checked, they were very pleased with the game plan, but they will go beyond that. They will do things many months sooner than the date established by the government. Next question, please.
Is from Anne Burns-Piper from the Institute for Investigative Journalism. Please go ahead.
Hi, it's Annie Burns-Piper. Good morning, Minister. Thank you for your comment on our team's reporting. This week we published a story which looks at how little data is collected on water-related health outcomes on First Nations. You have admitted that substandard water leaves communities more vulnerable to COVID-19. Given that, what specific steps are you taking to learn more about how water is currently impacting the health of First Nations people?
Yeah, and it is an excellent question. There's an issue of framing here that we need to that is different than what you would see, for example, if we were talking about the Minister of Infrastructure or another ministry that doesn't have the primary responsibility in its relationship with Indigenous peoples. The impression, I'm not saying you gave that impression, but the impression that I've heard in certain quarters is that the federal government should be imposing data gathering, should be imposing environmental standards. And we know from decades of mistake that the last thing you should be doing is imposing. The comment I hear is give us the money and get out of the way. It's something that we take to heart and we take to mind whenever we go through the very square policy envelopes that we have still at Indigenous Services Canada and across government. During COVID, we've expanded a lot of these policy categories with I believe, great results. There is still much work to be done, but when we talk about data, we first and foremost need to talk about Indigenous sovereignty over data and their collection, particularly when it comes to people and their health outcomes. It's something that Manitoba in particular The Manitoba chiefs have done quite well with great results. To suggest that the federal government should be imposing these things is wrong. It doesn't reflect the relationship that is necessary to be had between Indigenous peoples. Does it result by the same extent in a lack of information that we can collate and gather centrally? Perhaps. But I believe that if we work in partnership, we can get that data and be able to work with it centrally. When I look at health outcomes, it's very important. It's very important for what we've said as a government in terms of putting forward health legislation. You can't fix what you can't measure, and so there is a particular set of problems. We've had a very important community wellness index that has been very useful for the government. That is the result of StatsCan data and work that we do with communities to get their data back from us on every 3 years. The community wealth index, health index. So every 3 years, I don't believe that it necessarily measures water indicators as well as what you are perhaps suggesting we should do, but I certainly think it's something to discuss and to consider further as we move forward, because that is data that can help. If you have, we know that water insecurity in communities is often reflective of general wellness in a community. We know that from our experience in Grassy Narrows. So I leave it at that, knowing that that's an incomplete answer, but very important to have that framing.
Annie, do you have a follow-up?
Yes. We presented your office with research that showed that First Nations communities with truck-to-cistern systems face twice the risk of COVID-19. What steps is your department taking to learn why this may be happening?
You know, when we last talked, I asked you for that report. I think that was a few weeks ago, and I think it's actually very important that we get that data and take a look at it. I understand that there are issues with how water gets delivered, whether it's piped directly from the plant or into cisterns. But again, that data is important. I haven't seen it yet, and if you haven't, we talked about it during that interview. But I would be very, very eager to review it myself, because it is data that is always helpful to have, and I'd be glad to review it.
Thanks, Annie. Operator, next question, please.
Thank you. The next question is from Willow Fiddler from Globe and Mail. Please go ahead.
Hi, good morning. First question for Dr. Wong and Minister Miller. You say it's just a matter of time before the variants get into the First Nations. I'm wondering, what will that do to the curve that you say is flattening across the country? And can people expect that to be the third wave?
I'll let Tom go first.
Yeah, thank you very much, for the question. We're very concerned, and I think every Canadian needs to be concerned about the new variants. One of the things that we have to remind ourselves is that there are public health tools. It's adherence to those public health measures. We're still seeing individuals participating in large gatherings without masks, 200, 300 people. We are still seeing people going to parties, for example. And those are things that we must redouble our efforts. And each individual, all of us, in all communities, in the cities, we need to double down on the efforts. And we know that public health measures work. And in addition to that, there's the vaccine, and more vaccines are coming into Canada, as Dr. Tam and Major General Fortin have said, coming into Canada in the coming weeks, in the coming months. When there's vaccine in the community, it's so important, to listen to the vaccine champions in the communities, discuss with the champions, about what we know about the vaccines and how it could help, the spread of the virus, and to protect ourselves. And all of those are extremely important. When I said that it's just a matter of time, when it gets to northern communities, and when we look at all over Canada, Right now, there's a spread of the variants of concern in different parts of Canada. And we want to actually make sure that there's no complacency, because there's a constant traffic between the north and the south, and it's just a matter of time before the first case, will be showing up in whether it's First Nations, Inuit, or Métis communities. Thank you. And Minister.
Yeah, just briefly to add on, as Tom said, it's not a matter of if, it's a matter of when. And it wouldn't surprise me that we get confirmation that there are variants of concern in Indigenous communities. The potential consequences can be devastating for the reasons that you, Willow, have documented in the past, historical inequities. This virus can spread very quickly, and we have the data now from what we've seen in particular in the United States to prove it. And a variant of concern will require us, and will require to everyone, to mobilize an immense amount of assets to do things that we don't have to do in non-Indigenous communities because those historical inequities are not there. Every COVID case is not the same. It is in a northern and remote community that has a population per household that exceeds 5, 6, 7, 8, 9, 10. It's a tinderbox, and it can be devastating for a community. I did point to the US, but we had our own experience in Shamattawa where the positivity levels were well exceeding 50% over Christmas, and that was super scary. I want to take the opportunity to thank all the pandemic teams, Indigenous-led pandemic teams in the armed forces for standing ready, because if there is a third wave and it's variant-driven, it could be more devastating than the second.
Willow, do you have a follow-up?
Thanks. Yeah, I have a follow-up. I just received this a few minutes ago, actually, but Neskantaga First Nation is now declaring a state of emergency for its off-reserve members in the middle of an outbreak, they say, COVID outbreak. So they're saying 6% of their off-reserve population is testing positive, with 12, that being 12 members, one in critical condition in the Thunder Bay Hospital, calling on Indigenous Services to fund emergency housing to accommodate the homeless population who have been forced off reserve to a lack of housing. Do you have a comment or response to that? How prepared are you to offer assistance?
Yeah, well, we're prepared to offer any and all assistance. We've been in pretty tight contact with authorities in Thunder Bay. I think I'll pass it over to Valerie Gideon if she has any information on that.
Not specifically about members of Neskantaga, but certainly we've had outreach to, particularly the request for us was around a health human resource capacity, additional capacity to support the city of Thunder Bay that are experiencing a rising number of cases. So as the minister noted, we certainly will be connected to their emergency operations teams to look at whatever it is that we can do. And throughout this pandemic, we have funded supports for First Nations that are living away from communities through various organizations that serve their needs in urban centers or even in northern Saskatchewan, for example, where we were able to support the La Loche broader community during their outbreak situation. So we certainly do have some funding resources that we can leverage in order to be able to provide support to First Nations that are living away and are feeling either are directly affected by COVID or are feeling extremely vulnerable to an outbreak situation there.
Thanks, Willow. And this concludes today's press conference. Ceci met fin à la conférence de presse. Merci.
This concludes today's press conference. Thank you.